Perfect.
Are we okay?
We are okay, man. Yes, you're on and going. Thank you so much. I appreciate you being here with us this afternoon. And we got the pictures of your patient of the feet, which was just awesome progress that we saw with that patient. So I'm just going to kind of turn this over to you. I just want you to know, first of all, just give us a few facts, like, how long the patient was in bad shape. Obviously, we have HIPAA rules. We can't break those. We understand that. And then I want you to kind of just go down exactly what you did and what you felt were some of the big benefits of the treatment you did with that patient. That sound good?
Yeah.
Okay, I'll let you take it, sir. Go ahead.
Well, this is Dr. Rob Waterson. He's a recent graduate from Life University, and he just joined my practice not too long ago. What, 3 weeks now?
Yeah.
Awesome.
So he got a referral into the office, a young lady who had a concussion while walking across campus. Someone threw a football about 5 stories down, smacked her in the head. So she got this wicked concussion. So she came to us to get rid of the symptomatology of the concussion. And then she had these feet that were purple. And so I'm going to hand it over to Dr. Rob, because he was the primary doctor on the case. And I'll let him explain it to you.
Yeah, so she did an intensive care. So what we consider intensive is she came for 5 days, and each day she did 3 treatments. The treatments lasted between an hour to 2 hours. And one of the therapies during the treatment is using the total O2. And she used the total O2 each treatment, so 3 times a day, for five days. So she used it for about 15 times. And we had her on there with full oxygen for 12 minutes. At the beginning of the week, we saw that her O2 was plummeting pretty quickly, and we worked with her. And by the end of the week, we had sustained O2 throughout the total of 12 minutes, and her RPMs on the bike increased. So towards the end of the week, we were just checking some biomarkers, and we checked her feet out, and her feet were normal color like you guys saw in the picture. So that was pretty cool.
Pretty shocking, you know what I mean? She's like lying on the chiropractic table and looking down at her feet like it's never been this way. And she's been to, her dad's a podiatrist, and she's been to tons of different doctors saying that, we'll give you this medication, we'll see if it helps, and it never helped her. So she's kind of like in awe of what has happened with it. What we noticed with the total O2 is that when we put the pulse ox on her fingers, that when someone starts stressing their body, get a little negative O2, or they're doing some upper body ergonomics on the bike, that the peripheral nervous system kind of shuts down the capillary beds. And so then we kind of bring them back, maybe in speed about what exercise they're doing, maybe not do negative O2 on them, just give them positive O2. But it kind of reestablishes your autonomic nervous system in your brain, especially the medulla, and that nucleus ambiguous in the medulla that starts to control different heart rate and peripheral type of vasodilation. So that's basically what we do. And we're using it with every patient. Every patient that comes in gets total O2. We put them on for 10 minutes, and everybody has kind of a different type of program that we run with them.
Let me ask a couple of questions. So that was 1 week worth of treatment? Her feet got that much better in 1 week?
Yeah, we do intensives here.
Yeah.
So patients are with us for maybe an hour and a half. Okay. And we do other things too, right, like harmonic vibration. We have lasers in the office. We do different exercises. One of the things she had was a lot of cognitive aspects, right? Yeah. You want to explain what we were doing with her with the cognitive?
Yeah, so due to her concussion, she had a lot of cognitive deficiencies. She's pushing herself a lot. She was currently in graduate school, so she was noticing that she was working around 25% capacity. So we were pushing her cognitively on the NSI, doing a lot of geometric work, a lot of frontal execution work, and also visual centers. So just getting that visual stream going through the temporal lobe and then coming back to the frontal lobe, working on the executive. And then also we wanted to work on her basal ganglia inhibition work. So we were doing a lot of interactive metronome. And then we would also just bring it back to the basics in terms of primitive reflex and being able to cross crawl, walk, left arm, right leg. And then when she was able to do that, we would work in alphabets and also counting back from 100 by threes, just to really drive that cognitive output.
Well,
Man,
we
that's
did
awesome.
our gait test and the initial examination. We'll have them walk down a hallway and then give us the months of the year, every other month of the year. And she would stop every time she had to give an answer. It was like a freeze frame. And then if she got the answer, she could move on. If she didn't get the answer, she wouldn't move. She wouldn't move. So we wanted to get her frontal cortex like oxygenated, right? So,
Right.
you know, we're looking at periphery, but we also wanted to get the frontal cortex oxygenated. And we had thought about getting a oxygen tank, you know, doing hyperbarics in the beginning. And then when we researched the total O2, it really fit the kind of model that we do. It's dynamic. And what we want to do is we want to get people to oxygenate in a dynamic setting, in a stress setting, rather than just laying there doing nothing. So we're finding that it's a great feature that we have in the office to complete these intensives that we have. So an intensive might be an hour and a half. They might get neurofeedback, oxygen, laser, you know, whatever they need. They may get back on track too. They may get negative on track. We take care of the whole body when they come in. And we have great success with it.
I love the fact that, you know, I talk to doctors all over the country all the time, and you know, you're one of the only ones that every patient is getting oxygen. And I try to explain to these doctors that, you know, oxygen is one of the first keys to healing in the body, and that everybody who walks through your door, whether it's for back pain or it's for more of a concussion type thing or memory loss, whatever, everybody can benefit from O2. And that's where, so I love the fact that you're saying that, because you're just kind of just reinforcing what I'm trying to tell my doctors out there. There's not a patient that walks through your door that will not benefit from oxygen therapy.
Yeah.
Not one. So now you told me, so basically you were running just straight high O2 with her. Explain how you, what like in the oxygen side, what were you doing? You said she was on for 12 minutes.
Well, basically we have a Schwinn Aerodyne. You know what I mean?
Right.
It's not an expensive bike. It's, you know, I've had it for 25 years, something like that. So we have that at the station. The idea was that when we stressed her cognitively while she walked, she froze, right?
Yes.
So basically her system froze in many other neurological ways. So to put her on negative oxygen when just movement is too stressful for her doesn't really work for us. You know, for us, the purpose of negative oxygen is to put the body in a stressful state and see how it responds to it. Okay, and then you have limits. You have, you know, if it goes lower than 80% oxygen, then it goes high oxygen automatically. You know, you have these fail safes.
Right.
But with her, if we gave her negative oxygen, then fail safe would hit in 5 seconds. So
Okay.
we just said, forget about it. Just give her positive oxygen throughout the whole thing. And instead of giving her negative oxygen, we varied the speed.
Yeah.
Amount of RPM she was doing with her arms.
Okay. Yeah.
I think the lowest we were down to was like 15, right? Pretty critical. But once you start retraining your body, you get circulation to extremities, then you see some really fantastic things that happen. And you know, we're chiropractors, so we do treat people chiropractically. So we do a great job at treating different areas of the spine, as well as integrating with the brain. So we want to integrate everything that really kind of turns on people's nervous system again. When we get neuropathy cases, we find that people have had past brain traumas, right? So not only do they have low back issues with it, but they have brain issues with it. So we have to do a combination of brain rehab, maybe upper cervical work, and then everybody gets on the oxygen machine, and we want to see how their autonomic nervous system is functioning right. So basically, it's just, you know, the statement that it is important for every patient, that's really what it comes out to. It really is important.
Absolutely.
And if you don't try it, you never even know how important it is.
You're right. That's one of the big things. I think a lot of these docs are afraid just to throw people on it. I mean, you know, I laugh because I don't know, maybe it was four or 5 years ago, at one of the very first secret seminar here at Ergo-Flex, I had a doc that was there and had a back on track, and I actually wasn't working with Ergo-Flex at the time. I just had their equipment, and anyways, he said, I got a back on track in the corner. I don't know how to implement this in my practice. And I'm a pretty blunt guy. And I'm like, what are you talking about? Just start putting patients on the machine. Even if you don't charge them, put them on the machine, see what happens. And anyways, I kind of jumped on him a little bit. I actually apologized to him during a break. And he said, no, thank you. I actually needed that kick in the butt. So Doc, I'm hoping what you're saying is a kick in the butt for a lot of these people that are not utilizing their oxygen machine. Put people on it. It's not going to hurt them. It's a huge part of the healing process. Just put them on the machine. So, Doc, I mean, are you doing care packages, or do you break down individually? How do you charge for the oxygen?
We're doing all packages in the office. We're not doing individual treatment anymore.
Yeah.
Yeah. So, you know, we don't run a lot of people through the office during the day. What are we up to? Maybe 12 a day? Yeah, 12 appointments a day. People here for a long period of time. We're doing pretty intensive work. We'll do week-long intensives. We just got a gyrostim. So our intensives will be probably in September. It'll be $10,000 for 15 treatments during a week.
Right.
And then probably a minimum of 2 treatments. So 2 weeks here in the office. That gal is coming back Monday to start her second week of intensive.
Very cool.
So, but you know what? You know, getting a person better, you mean the word better, how much better are you going to get them, right? So the idea is that when we get a patient, when they leave, we want them to be better than ever, okay? Yep. So we have another patient that we've been doing the gyrostim with, and we did a week intensive a few weeks ago. And Dr. Rob was there with her, right?
Yeah.
You know what I'm talking about?
Yeah.
All right. So I don't want to use names on here.
Yeah.
When we finished with her, we got her cognitive system so good that when she was at work, she says, I'm killing it at work, right? So we could have treated her and got her eye movements better and her function better, but we want her to kill it at work. She's very competitive. She's a very competitive athlete, and she wants to kill it. She didn't want to just like, be working and getting by and stuff like that. So we decided that with every patient, we want at the end that they're killing it.
Nice.
So we need to have the technology in the office in each segment of our center that gets patients to the point where they're killing it. And one of the most important aspects that we have is getting oxygen to every cell in the body so it works better, right?
Yes.
So nerves go out throughout the body and they have to be oxygenated. And if their peripheral circulation is not working them right, then they're going to be losing neurons in that area. And we don't want it to happen. So we want people to be killing it when they're done. And with that statement was like
Yeah.
the best for us, because I mean that's what our goal is with every patient. So when we do a week intensive, we find we get people maybe 70, 75 there, but we want that little bit extra. And so we take it for another week and then we go with it.
Perfect. That's awesome, man. Thank you so much. Hey, Dr. Rob, you got a great name, by the way. So everybody calls me Dr. Rob as well. So, but hey, I mean, I wish coming out of college, I got teamed up with a guy like Dr. Schneider. I mean, you're sitting into a great situation. He's got so much knowledge to help you with. So, the only question we only got asked was just about what people charge, and I'll kind of hit on that. So, in my office, we do care packages too, and it's typically part of the package. But I do have a few patients that just come in and do oxygen, and we charge, depending on how they're going to pay, anywhere from about $15 to $25 a session. We run the 5-minute protocol. In my office is what we do. So they're on the machine for 5 minutes, and it's anywhere from about $15 to about $25. So it depends on how many they buy. Each session at a time, it's gonna be 25. We can get it down to 15 if they're buying multiple sessions at a time. So, well, anyways, anybody else have any questions for Dr. Schneider before we end this thing? You can you go ahead to your chat bar or you can actually, unmute yourself and ask the question. Anyone? Bueller? Right? Bueller?
Hey, Doc, can you hear?
Yep.
I can hear you.
I think JT had to take a call earlier, and I believe we wanted to know how many treatments did it take to get that lady's feet fixed, basically. I mean, it's incredible what in such a short period of time. So what was the protocol in the beginning? How many times a day was she on oxygen? How many times a week?
It was 3 times a day.
3 times.
And then what was it, Friday morning?
Yeah, it's about right around 15 treatments. So right around 3 times a day, we did oxygen for 15 treatments. So you could do the math on it, but it was about 12 minutes a session.
Awesome.
Did you literally, hey, Dr. Joseph.
Hi.
JT, did you literally see the color in her feet? When did you first see the color in her feet and her lower extremities start to change?
Is that the same person? No, it's unbelievable. Dr. Rob was you were looking at her ankles, right, most of the time.
Yeah.
To see if we were getting changes, and she started getting changes pretty rapidly.
Wow.
Yeah.
That's, I mean, to me,
And we don't do 5-minute treatments.
No, yeah. Absolutely.
Yeah, we'll do multiples. Like,
well, you've got to saturate her. I mean, what was her oxygen level in her lower extremities there? Did anyone ask that question?
No, nobody has.
well, we don't measure that. We only use the fingertip pulse ox.
Okay.
Yeah.
And so, say her father is a podiatrist.
Her father's a podiatrist. Yeah.
What did he think about it?
You know what? Relationships are hard. So her relationship's kind of hard with her parents and her dad, and they're not really big fans of chiropractic. Not that they're against it or anything like that. I just don't think they understand it. So I talked to the mom, and coming to our center was like a real leap for them. It's a shame, and that when patients have concussions and they're going through all the symptomatology, they're being diagnosed now as being psychotic and neurotic.
Yeah.
And so I think her parents got to the point where they really didn't believe that she was suffering as greatly as she was. And so when she came for her initial examination, and that's really kind of, for us, the proof is in the pudding, she really found that when we did the examination that we understood her. what she's been going through. And that was the key for her to want to come in, because none of the doctors really made a lot of what she was feeling. And in her history, the doctors didn't make a lot about her feet either. You know, I mean, okay, it's going to go away. Just take this medication, so forth and so on. So that understanding, that empathy and compassion about what people really go through when they have neuropathy, where they have a concussion, where they had a stroke, or so forth and so on, is not present to a lot of patients. So
she was very young, correct?
yeah, she's in her mid-20s, 23, 24. Correct.
How long ago was the concussion before she came in? You remember?
About a year.
Yeah, well, the original concussion was in 2017. That's when she was knocked out, which we really believe was the initial brainstem injury. And then she had minor concurrent concussions later. But what really was taxing her was that she was in grad school and she's doing so much heavy level work, she wasn't able to do it anymore. So she really needed to come in for that.
Now, if you don't mind, could you kind of like walk me through like you know, you said they came in she comes in 3 times a day. So like she walks in the morning, what is she going through besides oxygen? What are you doing with her? Give me like a walk through the AM session with me.
The cool part about our practice is that we're so dynamic. We're looking at symptoms as soon as she comes in, between pupillary dilation or just cognitive function, walking gait. So realistically, it would be tough to tell you the exact scheme of what we would do, but in any given day, she would get neurofeedback, she would do heart math, she would do harmonics, right brain eye exercises, she'd do NSI, IM, oxygen, laser treatment, and then she would get adjusted. But that could change up in any order. We could add one, we could take one back, depending on her cognitive state.
So you said, so she comes in the morning, she gets some form of that done. And then when she comes back for her next session, you guys are basically evaluating her as she goes and changing the protocol as she goes?
Yeah, so based on, so she would take about an hour break. She would come back. We would look at how her symptoms are doing, what's progressing, what's retracting, and then take the game plan from there. And that's what's so fun about it.
Man, that's awesome. That is so cool to hear. I would love to come up to your place sometime just to see how you guys are doing that.
Oh, you're welcome anytime.
Yeah, I would love to come up to see that.
Was she in a lot of pain in her lower extremities with her feet? Was that painful for her to walk, or?
I don't believe she was in a lot of pain. I think the most pain she was having was almost psychological, psychosomatic pain, because we live closer to the beach and she was just mentally drained from not being able to show her feet anywhere. So I think it was a lot of psychological pain, if anything.
Okay.
Well, awesome.
First time I saw it, I said, "Oh my gosh!" The next step is, if would be amputation. Me looking at something like that, I mean, that's what
she got a sore or something like that on her feet. It probably ended up that way. Yeah.
Yeah, you got to worry about gangrene, something set it in. So.
Okay.
God bless y'all. Yeah,
Thank you.
Y'all,
Yeah.
I think God's here right now, so
yeah.
Amen to that. That's
Keep 'em
right.
coming, baby.
Wade, Doc, thank you so much for your time. I appreciate it. You know, there's some people asking about your care packages and what those consist of. I don't know if you want to share those or not. You know, if you want to do that, like I get asked that all the time by docs all over the country. You know, what's a typical care plan look like? You know, what's the average doc charge? And that, if you don't mind sharing that, and if you don't, that's not a big
Yeah,
deal.
an appointment can go anywhere from $300 to $500.
Okay.
You know, we're even getting up to $700 an appointment. It's really intensive. It's not anything that would be just, you know, they come in, they go through the paces. Like Dr. Rob said, it's dynamic. You know, it could change from appointment to appointment depending upon how quickly they come along. You know, so that, but right now, I think we're moving toward to be mostly intensives. So we'll get people out of state, we'll get people local. Locals maybe can come in like once a week and do 3 times a day, and then come back another week and do 3 times a day. So we're moving, instead of one treatment at a time, to multiple during each day they're here.
Well, that's awesome. To me, that you're going to fill a gap in our healthcare system that you know, a lot of these people fall through the crack because nobody thinks they can help them. So that's awesome to see, man. That's just a huge, you know, I as a chiropractor and Doc Schneider, I know you've been doing this a long time, just like I have. So, I mean, we've heard it all. You know, we've heard all the negativity, and then when I hear something what you guys are doing, man, it's just awesome to hear. So I just want to say thank you from terms of the chiropractic profession. I mean, that just helps us out and just gives us more and more integrity with the medical community out there. You know, it's funny you said, you know, the podiatrist parent isn't a big chiropractic fan. Some of my biggest referring people in my 27 years of practice have been podiatrists. They seem to understand what we do. So, but anyways, I just want to say thank you. Thank you for your time. If we have any more questions, I'll probably shoot you over an email or something if we have anything else we come up with. But thank you for sharing.
So much.
Dr. Rob, thank you for going through what you're doing with the two, and congratulations to pairing up with Dr. Schneider, man. He's got a wealth of information to teach you. So that's awesome. Y'all take care. God bless and have a great day.
Thank you. Take care.
Thank you.